on males and advocating through males. And I would ask my colleague here, Mr. Sanatan, to go through and probably provide some insight into that, as well as our Director of Gender will provide some insight into what some of the services that we are already providing in this area. And of course, Dr. Sebro will add as well. So if you allow us, Mr. Sanatan.
Thank you very much. Thank you very much, Permanent Secretary Ganga Prasad. And through you, Chair, I now have the opportunity to respond some of the issues raised by members on looking at men and boys and their essential role in menstrual equity. For us, there is no way to spell menstruation without the word men in it. And we think that menstrual equity is something that we must advance in gender and child affairs. One of the first areas we would continue to advocate on is the issue of voice, that men and boys play a role in amplifying women's voices and experiences to be heard, but also prioritized in development. The second issue is advocacy in the public service, where we see how male educators should be equipped with the knowledge, resources, and communication strategies to discuss menstrual health and hygiene, as well as menstrual equity to all students in educational settings. When we have activities such as the Barbershop Initiative that has been led for several years by Gender and Child Affairs, we create safe spaces for men, especially adolescent boys and men, to confront issues around gender equality, but also understanding the relationship between the biological and the social. Next, we need to look at men's role in public planning around construction and the creation of period-friendly spaces, as our director, Ms. Shelley-Ann Hart, has advocated in the public sphere. We see potential in continued partnerships around engendering things such as the latrine eradication program that has been led by the Ministry of Rural Development and Local Government, as well as the Ministry of Housing and Urban Development, because we understand in Gender and Child Affairs that the latrine eradication program contributes to safe and hygienic spaces for women and girls to experience a menstrual cycle, but it also redresses the shame that could exist in communities around menstruation. Next, I have two more points around sharing the care. Engaging men for gender equality is important because it continues the idea of equitable contributions of all people in households. And it really removes the shame, especially around people in vulnerable settings or who live with latrines and outhouses. And the last point is men and respecting women's rights and bodies. One of our principal mandates is around ending gender-based violence and sexual violence. The issue of women's period cycle has been a site of contestation and even violence in some dating relationships and intimate partner relationships. So the discourse around periods must be addressed in order to have safe and healthy intimate relationships among women, girls, men, and boys in Trinidad and Tobago.